Welcome to the Tradners podcast. This is episode 32. Today, I have on the show a friend who's gone through quite the personal health journey, having had brain surgery and several other medical issues that have popped up. And I would like for Mike to share his story. So, Mike, welcome to the show.
Well, thank you for having me.
And the floor is yours. I want you to take us through leading up to the brain surgery and your journey through the healthcare system. We'll just go from there.
So I believe it was 2020, Friday the 13th, 2023. I was hit head on by a car during a snowstorm, her fault. I went to the hospital. I broke my neck. I was being treated for that. And this all stems from the same episode. Is they took me off a blood thinner to give me an injection in my neck. That's how it started. So they took me off the blood thinner. I ended up having a blood clot in my leg. I went down to see the doctor. Within 15 minutes, I was in surgery. So I came out of surgery and I stayed in Miller, in UVM, for 5 days. And I had a fantastic experience with the nurses. They were young, I'd say within like 3 years. That's their career. Very sociable, very they cared for their patients. This one girl was from St. Albans, which was just a town over, and she came and checked on me. She was my nurse the first day, and then the third, fourth, and fifth. So, but on the second day, she stopped in to check on me, and very bedside manner. I've learned what that is. It's so important. Like, I think you guys take an oath when you do your training.
The Hippocratic Oath.
Yeah. So on this journey, I just want to point this out. I feel like when I go in the hospital, I almost hire you. You guys work for me, kind of. I like to say that because sometimes you get the nurses that the old bags. I don't know if I should say that, but that just don't care about life. And these young girls injected just greatness into my soul, and I thought, this is the best thing ever. I love it. So after that, the doctor, I had some downtime, so I lost a little hearing, and we took an MRI of my head in St. Albans. The doctor called me within an hour and a half of the MRI. I was like, that's kind of weird. Called my doctor. We three-wayed a call, and that doctor suggested I went to Dartmouth. So I went to Dartmouth found a tumor. I'm sorry, I don't know if I said that, but found a tumor, and it started growing. It was getting big quick. So I thought I should have it removed. So I went down to Dartmouth 3-4 times, talked to the surgeon, talked to the doctor. Everything was great. I came out of my surgery. I had such a headache, didn't know where I was. Things didn't feel right, caused my face to droop. They cut my facial muscle, but I had traveling nurses, and they would tell me, because they were, like if they're from Texas, you could hear in their voice what their accent was, and I'd ask them all the time. And those nurses was like clockwork. They would come in, give me my medicine, offer nothing else, as in like just to check how you doing. They would write their notes, how they felt. I answered, which was not always how I answered, which was, he was up on this date, no complaints. Well, and the traveling nurses just didn't connect. There was no connection. It was like they were there for a paycheck. One guy told me, this one nurse from a traveling nurse, and he's, let me see, how can I say this? Toward the end of our journey, I was in there for 30 days. And this guy was telling me, I'm here for 5 weeks trying to he told me like $2,500 a week or something. And I was like, no, you're just a milker. So one time I had a catheter in me because I couldn't walk. And there was actually two nurses says, you can't go home till you pee. So he said to me, you can't go home until you pee. I said, that's BS. This is not an effing prison. I said, I'll go home when I say I'm going home. This is 31 days I stayed in the hospital. I have two nurses arguing with me that I can't go home till I pee. I said, get the effing doctor, because this is not a prison. You're not holding me prison. I actually called my nephew from 4 hours away, and he drove on a Friday 4 hours down to get me, because these nurses And when they walked in the room, my blood pressure would rise and my
Yeah.
anxiety kicked in. So
Yeah.
then the bells and whistles were going off. I don't have very much experience with traveling nurses except for those 30 days,
Yeah.
and I didn't like it.
Well, why weren't you peeing? What
Uh,
was going on?
when I go in the hospital, I can't pee. I don't know.
Yeah.
I don't know if you ever heard that, but I just can't.
Yeah.
So I tell them I don't want it because it hurts, but I got to be catheterized. So
Yeah.
and then I told the doctor when I get home, I'll let you know because as soon as I get home, I'm gonna pee. It just happens like that. I wasn't never argumentative because I had a headache for like 3 weeks. I wasn't argumentative. The only thing I asked for is a lot of ice cream, and it was a bother for the night nurse. And they were every one of them were traveling nurses, everyone, and it seemed like a bother. So I didn't want to ring my bell. That was my experience with them.
Yeah. It's not okay.
Like I said, I left the hospital because of them. Um,
Really?
Yeah, that my doctor said, "I can't hold you here no more." So I went home with the home health
Were
nursing.
there mostly all travel nurses or did they have some
No,
permanent
they had a
nurses?
charge nurse and the assistants or no, what they call them,
Like the
the
nurse's aide?
yeah, nurses aid were local, but the amount of nurses that Dartmouth uses from traveling nurses is unreal. And like I said,
It's everywhere. It's all hospitals, unfortunately.
I shouldn't have gone home because I couldn't walk then. I made it to a wheelchair. I had him wheel me out, but that's how much they pissed me off. Just bad experience for a month. And it wasn't the same
Yeah.
one. There were 12-hour shifts, girl would work days, guy would work nights, and yeah.
Right. So you came home, you did you sign yourself out against medical advice or did your doctor
Oh,
release you?
my doctor released me that day. I didn't give him a choice, kind of, because I said, I'm going home. My ride's almost
Yeah.
here. And when he got there, the nurses were like, "You weren't kidding?" I said, "No." I said, "I'm effing leaving." I should have stayed longer because they were trying to put me into a rehab center. I said, "No chance." And
Yeah.
I just worked out in my house myself.
And so they wanted to put you in rehab for what? Physical therapy?
Physical
Speech
therapy.
therapy?
At first, yeah, they wanted to do speech therapy, but more physical therapy to learn how to walk because when he cut my nerve, it gave me seasickness, like, it's not motion sickness, and there's a big difference. Like, the seasickness is like this, and I
Right.
felt like I was walking on a ship, so I had to deal with
Right.
that while trying to walk, and I took a couple spills at home.
Did you have somebody helping you at home or did you just come home and just
No, I just
figure it
came
out?
home. They sent
Yeah.
home nursing, and that was bought out by a different group. I don't know if you heard of that. Some down in Rutland Bottom. So they sent a girl to me and she gave me exercises with a piece of paper. We never did any. Just give me the papers. And the third time I was kind of a jerk because I said, I don't need you. I know what the exercises are. If we're not going to work, I had to check some wounds, but that was it. But yeah, it was a journey. They retired me right there. The doctor signed off on my retirement. I was retired within 6 months. That's usually doesn't go that quick.
Are you on any medication from this?
Oh yeah, I'm on a actually Lyrica buperspin. Does that sound right? Buversin.
Is
It's a
that like a diuretic?
no, it's a depression pill.
Okay.
Yeah. It takes the mood off real good, real quick. I do have diabetes, but I'm not on the insulin. I got that under check. Like so, yeah. I got a couple medicines. I didn't expect to answer that today.
That's okay. It's the nurse in me. I always try to get the full history.
So today, can I go on to another story?
Yeah.
I went to Burlington today to see my guy that scans your arteries. Oh my God.
Card cardiologist?
No. He did in my legs. He would make sure that your arteries are clean and stuff like that. And because my leg had a stent in it, that's what when he took me off the blood clot medicine, it all happened at the stent. But anyways, so today I was there and the nurse in the office, I never saw her before, and she says, "Hey, come on in, big guy." They took me in early, read my chart, we talked, and just very personable. I loved it. It's like seeing a family member almost. And just
Right.
like, "Hey, you're here. Let's take care of you." And so I will give credit to UVM nurses, the ones that not every I've had a couple, but most generally I've had um, people in a good mood,
Right.
and they seem happy to work
Well,
there.
I'm not even convinced there's a nursing shortage. And in Morrisville, that small little hospital, Copley, where I used to work, it's 90% travelers.
I like Copley. They're
Yeah, it's a great hospital. I loved working
right.
there. But in order to build the nursing staff, you need to have full-time nurses that are there, and the travelers they're just there for 3 months, so sometimes they extend to 6 months.
Right. What
Wow.
why did you become a nurse?
I became a nurse right out of high school.
I know, but why? Why? To help people?
I'm also very pragmatic, and I didn't know still remember this day, Mr. Mitchell goes, "What are you gonna do?" And I'm like, "I have no idea. I'm gonna go to college." But he's like, "Well, what are you gonna study?" I don't study. So so he had a newspaper, the New York Times, in his little den area, and I looked through the want ads, and I was, "Oh, a registered nurse register." There's like pages of registered nurses, and I closed it, and I go, "I'm gonna be a nurse."
Now,
You
on a
know?
traveling nurse, do they have to pay, like, workman's comp benefits and all those things?
I mean, if they hurt themselves, they'll get workman's comp through their company.
But they're
Oh,
self-insured, right? Are they?
so they'll work for a company, like, let's
Right.
just say
Hold on.
Supplemental Health. Supplemental Health is the company the traveler nurse works for, so she doesn't work for the hospital. So she gets her insurance and whatever
Oh.
package they give her through the company, and the hospital doesn't really the hospital just provides a schedule. Even
So the hospital doesn't have to pay those extra benefits, and they say if you make $100,000 a year, that your employer almost pays another 100 just to have you work in there with your
Mhm.
benefit. Health benefits are crazy, but they're trying to cram so many hours in, they're kind of just being they're tired and they're kind of
Oh,
bitchy. Yep. But
yeah, the nurses work 12-hour shifts. You rarely get a break because 'cause you're always short-staffed. Wouldn't suggest to a young woman who wants to have a family go and become a nurse.
I've seen a husband and wife that were actually ended up in St. Albans, and they were making some good money, but they were always working. Couldn't spend that money.
They're together, so that would work. I've seen that a husband and wife situation work out too. But you pretty much devote so nursing, I don't know, a lot of the people don't know this. Nursing started with the Catholic nuns. The nuns took care of the sick
Yeah.
and they prayed over the sick and they cared for them. Florence Nightingale decided to
Yeah.
take that faith part out and just make it about hygiene and tasks. So that's my reason why nursing is so messed up. Because to care for someone, it is an act of mercy, whether you're getting paid or not. It is an act of kindness that you're doing for another human in their most vulnerable time.
And I'd say just a little sympathy, just a little.
Yeah.
And
It's not just a job, it's a vocation. And people, when they're sick, they're at their most vulnerable.
correct. I feel bad. I take people to medical appointments now. I do that as a volunteer. I do cancer patients. I do dialysis, and sometimes I get people coming out of the car just giving me their experiences with that. Some of the guys can be racial sometimes, and they'll complain about she jabbed me too hard, and I was like, she is doing her best to help you, I would think. Then I think about, was she a traveling nurse?
And when I went to nursing school, it was a Catholic nursing school. So we
Yep.
were taught bed bath. That's the first thing you do for your patient. You make sure they're comfortable and that they're clean. And that bed should not have any wrinkles in it because that's not cleanly and they can get pressure ulcers. That was drilled in us. I don't know what these new nurses are being taught,
I
but
laid
they're
my
not
own.
giving baths, they're not cleaning their patients.
Ellen in New Hampshire, an LNA came in and says, "You ready for your? Do you want me to clean you up?" I said, "The nurse don't do it." I said, "You're just walking off the street." I mean, I was thinking, sure, go ahead." But I laid my blood though in New Hampshire because the back of my head bled on my pillow, and I laid in there for 6 hours waiting for a nurse to, and they knew about it right at shift change. Yep. I had such a horrible experience down there. Well,
That's
I
so
would.
awful. It's sad to hear because
It's a teaching school, isn't it? Dartmouth.
yeah,
Yep.
yeah.
And
You expect a certain level of care. You expect a certain level of care. That's the thing. Like a lot of nurses are forming unions, especially in New England, because they need safe staffing ratios. In the ICU, you should only have two patients. In
oh,
step down, you should have three or four at the most. In cardiac, five at the most. Med surge, 5 to 6 at the most. And nurses are getting more than that, and they're not able to do the care that they should. So they're unionizing, and I'm not a big union person. I don't like unions at all because it's just another layer of bureaucracy. But what I'm noticing, hospitals are not even talking to nurses about pay, about making it better, because now the union is there.
it takes, yeah, again, it takes away from the nurse, you
It
know?
takes away from the nurse, and it ultimately takes away from patient care.
Yeah, I should have said that. Yeah, you're right. It does.
Because the nurses are having to deal with bargaining. It's just an extra layer of bureaucracy. And then you've got the insurance companies dictating what to do, and HMOs, and you also have the pharmaceutical industry dictating what meds you can give. It's a
And
mess.
how much to charge for insulin is one of the biggest rackets, I think, in this country. I know people that are hurting because they don't take insulin they're supposed to, and because they
Yeah.
can't afford it. It's just a racket. But
Insulin, I don't think it's that expensive to make. I should probably look at that before I say that.
there's a lot of it here in the country. There's
Yeah.
a lot already. It's yeah.
Yeah, so healthcare, I've
I
seen a
don't
lot
I
of
don't
changes.
I don't understand how Canada makes it work. I don't know. I talked to a lady that's a nurse there. They moved down here for the summers, and she loves her job. She likes
Where does she
dealing
work? In
um,
Canada?
in Montreal. Yep, in Montreal, and there's no talk of shortage up there. I think we should do more for our nurses. Maybe they say waive away student debt. How about the nurses that's paid off their student debt and you can't I think you should go they shouldn't have to pay income tax for a while. I really do.
Another big racket that they were getting nurses was overtime because they make it mandatory for us because they don't have anyone to
Right.
help, and then we get taxed on that. We get taxed more, so you actually don't make as much. I think
Oh,
that's changing now, but for a while you did not want to work overtime because your paycheck would actually be
you'd
less.
almost be working, yeah, for a lot less money per hour. I agree with that.
And I don't think nurses should necessarily do 12-hour shifts. And if you do 12-hour shifts, maybe limit it to 3 a week because you don't have a life by the time you get home.
Especially I especially for the women or men that work nights.
Yeah.
Well, it's a hard shift. Just being
They don't give a lot of like, incentives. I think down here you get $5 or $6 extra an hour. It should be a 10 an hour, 10 extra an hour. Just because no one else wants to do the nights. I just found a supervisor job down here, but it took me a while to find one that paid. Florida doesn't pay nurses. I didn't want to work nights. I'm not working nights. My body can't do it anymore. When I was young, I did it.
I worked 5 years of nights. I know what you mean.
It's hard. It's hard on your
Yeah.
body, and no.
Here's a crazy one, and I'm not racist, okay? No.
Mhm.
But when you take care of a patient, you should know English, don't you?
Oh, 100%. The thing I hear the most, because we
Yeah.
have a lot of nurses here on the H-1B visa, so they're foreign nurses. I hear I don't want my nurse or my doctor to be from India. I want an American nurse.
Yes. That
I don't think that's that bizarre of a comment.
it is because I couldn't understand 2 of them that I had. I don't know if they're from Haiti or where they're from because I couldn't understand them. They were shooting pills in my mouth, and I didn't even know what I was taking,
Right.
you know?
No,
But
you should be taken care of by American nurses.
or English speaking, really good
And
English
yeah.
speaking. Yep. Okay, I thought that'd make me racist. So good.
No,
No.
I'm so sick of that word. They've overplayed that word so much. Everything is you're a racist. Like
Yeah.
we've gone so far crazy that nobody can even have an opinion anymore.
You know, I worked corrections for a long time, and then I switched out to truck sales. But in corrections, those nurses are hired by a private company who will hire just about anybody, but there's no protection for them. That's a tough job down there.
I don't know if it was even, I think it was 3 months as a director of nursing at the jail in Newport.
Yep.
Let me tell you, I had to leave. I couldn't do it psychologically. I just couldn't do it. I didn't have it in me to like have that tough skin. You can't even put a pen down. It's gone. You have to be
And
so
when they
aware of
take
your surroundings.
it in
Uh,
their mouth and not swallow it, then
That's
fight with you.
crazy. Like their Suboxone or whatever they put in the
Yep.
cap of the pen.
There's no nursing school, but they like to hire a new nurse when
Yeah.
they're fresh out of school. They'll hire you for $10 an hour. I used to, with my female nurse, actually, with my male nurses too. If they were in a window, I was right there with them
Yes.
because I've had a
Because we don't
nurse
have any
yank through the window.
protection.
Yep,
They're all young nurses, or they just don't want to do nursing. And so they end up in corrections. I remember we had a young girl. She was an overdose. They have a holding area
yep.
there as well as the main prison. So she was in a holding area. She came in as an overdose. And I remember saying to this young nurse, you need to assess her. And I want you to assess her well. None of this just check boxes. I just have a feeling. Because you get a feeling as a nurse, as no matter what job you do. I'm like, just make sure you do a really thorough assessment. Next day I come on, she ends up getting transferred to the women's jail. She had fentanyl somewhere.
Oh, yeah. There's a lot of
I
hiding
don't know
spots.
where, but she ended up ODing, and the guard that was taking her to Burlington ended up ODing. It got diverted to the ER in St. Albans. This is from Newport to
Yep.
St. Albans to Burlington. And of course, that's going to look bad on the nurses because there was nothing, no assessment done, nothing in the chart because they just don't care. And this is going to get audited and it's going to look really bad on nursing that you didn't even go and put your eyes on this patient.
The mental health part too is just,
Oh,
check the same boxes. Don't sit down and talk to them. And I've had a couple people string up on me. It was the baddest mental health assessment. And the guy, after talking to him, sit down, just face to face talking, told me he didn't want to be there and stuff like that. And he wanted to end his life. But that was never done on an intake. But those nurses are included.
absolutely. I was fascinated with corrections nursing. Like, I wanted it to work for me because it was a really good job. And different kind of a stress than hospital setting, but the psychological aspect of it was weighing on me. On me. I could not just cut out to do it.
We
So,
had a we had an inmate in the infirmary, and he fell out of his wheelchair and he started foaming out of his mouth. The nurse checked, he's not breathing. So she told two corrections officers to start CPR. I'm not sure why she didn't have anything to do with that, but we did CPR. I didn't, my supervisor. When he was frothing at the mouth, I told him to go grab one of those triangle things, sit on their mouth. You know what I
mhm.
mean? I was puking just seeing him foaming. Anyways, yeah, the nurse, she didn't touch him. Just the correction officer did. I was like, wow, that's her job. But again, I think it's an underpaid, I don't care type of job.
Yeah. And there's a
I think
lot of travelers too in that industry in corrections nursing too. And then I didn't understand why the medical piece is a different company than the corrections. The state of Vermont was in charge of the corrections and then the medical piece, because I worked for a company called Vital Core.
to be state. It used to be state nurses that were hired for the state of Vermont. And then it was a great idea to have some low paying company come in and take over. They weren't sending inmates to the hospital
Yeah, it was really awful 'cause you had to go through the company for everything, and it was
for their
just this
approval.
extra
Yep.
extra layer of nonsense. I don't understand why the state just doesn't manage the nurses. It would be less money.
Because I think they don't have somebody with
A medical
like,
degree?
no, no, have a sack, have some cojones to do it. I just, people like, oh, I'm scared of that. We did
When
have a doctor.
It's
Oh,
okay that we're changing the topic a little bit because I do like this topic. When did Vermont go from making heroin addicts It's a disability. In the prison system, all of the prisoners get put on the MAT program, the medication assisted treatment, which is the heroin alternative.
Or when we first started with the heroin problem, I used to feed them sugar, and it would help them come down. It would.
Mhm.
I give them packets of sugar when they started detoxing.
Detoxing.
One inmate told me to do that. An inmate told me. So I give him sugar, a lot of it, and it would help him come down. There's a place in St. Albans that I did not know that BARRAT maybe. You ever heard of
Yeah.
them?
Yeah.
I didn't know what that was. So the first person I brought there had a little suitcase with him. Didn't know what it was. He came out. The next one I took, I walked inside with him. I didn't even know what we were doing there. It was they'd fill up their heroin treatment bottles. And the nurses, they were pretty, let me see, what's the good word? They've been there for a while and they're like, they're sick of seeing different personalities. You're
Oh.
next, go ahead. You know,
Was it the methadone clinic that you were
yeah,
taking them to?
yep.
Okay.
It's right in St. Albans by the industrial part.
Yeah, I know where it is.
I didn't know what that was. I've been here for 55 years and I didn't know anything about it until I started transporting patients. And they'll ask me once in a while, hey, can you bring him from Montgomery to here or
Right.
Enosburg to here? I do a lot of trips in Enosburg, but
Well,
I-
now they have these clinics right in the jails because 90% of the inmates are on that program.
will it make somebody high if they're not, even if they're not a user?
You have to be a user to get on the program.
But will it make you high if you take it and you're not a user?
Mhm. Yeah, it's like taking heroin.
So can I say to you, hey, I'm a junkie.
Yeah, and then I would assume that you are, and I would
Right.
tell the doctor. They would have to do a drug test to see that you have it in your system. That's part of
Yeah.
it. But the problem is, like back in the day, people that were heroin addicts, they just detoxed when they got into jail. We didn't
Yeah.
give them something to continue the high, and then you're on it for life. There's no incentive.
The Grateful Dead concert, I was working booking that night. I must have 30 people that were high on I didn't know what heroin did to you. And like and we treated like I said my sugar trick. I didn't know what but they detox right there.
They went they at the Grateful Dead concert.
Yeah. They were bringing people in. They were trying not to arrest drunk people, but
Yeah,
the one guy, he came in at a 4.0 BAC, the
yeah.
breathalyzer, almost dead, but
That's just something that struck me funny with the prison system that heroin is considered a disability if you're a heroin addict and they give you the treatment for it. Other states don't do that. I know Alabama doesn't do that. It's cold turkey. Mississippi, those more red states.
I look at the sometimes I can see a chart when I go in the office once in a while to say hi, I can see a chart like how many people need to. We take buses. We don't. I'm not saying we. They do. They take buses, loads of people down to that clinic every single day, and it just Medicaid pays for it. There goes some more healthcare money. But
Yeah, they have it right in the jails now. They have a clinic, a nurse.
would it would it be cheaper though? I'm just curious. And so one of those clinics, would it be cheaper to go into the community, have them go to a little bus and get their bottles filled, and wouldn't that be cheaper?
I think this is why you have such a problem, especially in Vermont. A lot of the pharmacies have shut down because they're giving them a pharmacy prescription for their heroin substitute, Suboxone or whatever it is. It's okay. There's no judgment, but there's still a seeking behavior, and so I don't know what the answer is for our communities, if it's a bus or
But I feel bad for those nurses too because I know a couple of them that work there that can't get a job, as in the standards, or I don't know what it is, but
wait, they can't get a job
like I'm at the
elsewhere?
hospital, like at the hospital.
Probably because they don't have the skills to work at a hospital once you've been out for a while.
You have to be an RN to give out meds.
Mhm.
So what happens at the prison when somebody calls in sick and you don't have an RN on shift?
I would imagine you would have to call somebody in because they can't not get their meds.
Oh no, no. Be a rough day for the corrections officer. Yeah. But so I think this healthcare with an I think this is a good for a new nurse to think about career and
Mhm.
what it really takes and almost,
Absolutely.
when
And
I
also
went
to
to
know that it's not all glory and all your patients are warm and fuzzy. Every day is different, and you have to check your emotions at the door. Be prepared to give 100% to whatever the situation is that arises, because there's many dynamics that come into play,
I
family dynamics, especially.
I'd like to see a 30-year nurse or 25-year career nurse take a little extra training sometime, you know?
Usually those 30, because that's where I'm at. I've been nursing for about 30 years now.
Yeah, but you're on this podcast because you care.
Yeah, I wanted
You
I wanted to make it better because
Yep.
what I'm seeing in healthcare is I'm embarrassed. I'm really embarrassed.
I like sometimes the older nurses, um, feel like they have 25 years and you know, they don't
Yeah,
wanna
that's
do this,
true. A lot it's hard to find a nurse that's been at the same place for 30 years though.
yeah, yeah, you're right.
It's easy for us to move around because there's so many jobs,
Have
you
you
know,
ever
and
noticed you ever have a questionnaire for nurses? How many of them drink wine?
it's a prerequisite.
Yeah.
You gotta get through it. You gotta get through it somehow. So
Well,
I'm all for the wine after a hard shift. Although I would say, like, having a really good nurse friend to debrief is
bounce it
best
off them. Yep.
instead of like coming home and because you're just unloading on your significant other or your family. That's another thing that nurses need to know, that you can't unload on other people because your job is so hard. You have to figure out
And,
how to manage that.
you know, it's funny you say that. Probably 20 some odd years ago, my daughters played hockey. Right before that, I coached them. And we'd on our way home, and I'd say to one of them, "Hey, you could have done this better, that." But and my wife looked right at me and she says, "You coach the rest of the team at home." I shut up. She
Right.
was 100% right.
That's the
You-
best advice. I love
I
that.
learned that,
You can't take
and
it home. I'm going to do a different podcast on how many nurses are divorced because we didn't learn that early in our career.
I think you were doing that. But one more question, if I might. I went in the Navy right after school. I took an oath that I would fight for the country and die, right? But I was willing, I accepted that role. I never had to, but is that you guys take a oath, like you can't drive by somebody if they're hurt. You gotta stop and provide care, right?
Mhm,
Is
mhm.
that just a common oath or so actually it's
Well,
legality, isn't
our
it?
Hippocratic oath, all medical professionals take it. We take an oath that we're not going to do any harm.
Right.
We're going to provide care to you in the best possible way without doing any harm. So there's that. And then there's the good Samaritan, which is if you see somebody who needs assistance, medical assistance, you are to stop and buy a CPR. Some nurses aren't even certified CPR. And also ACLS, advanced cardiac life support, so I could
Yep.
defibrillate your heart and run a code if I had to. So,
Okay.
yes, I would stop because I'm useful. If obviously the paramedics were there and they didn't need me, I would back off. But if they didn't have somebody to fill that role, to restart your heart, do CPR, find an AED, and save someone's life. But yeah, we are supposed to do that.
Where you're not supposed to harm literally, I think that's mentally and physically. Wouldn't you say? Or no?
Oh, yeah. There's
Yeah.
so much gaslighting, medical gaslighting in healthcare.
When a third shift nurse goes home and a first shift nurse is coming on, he had a good night and blah blah blah. This is his vitals, and they're so quick to get out the door. That debriefing, like that's what I've seen.
A
But
report when you
yep,
give the oncoming shift and the offgoing shift report.
I've seen it go both ways. Where somebody wants to get out the door, and
That report
yeah,
is very important before you start your shift. You have to know who you're taking care of and what happened during that shift before you. It's very important.
yep,
You can't come on and just start nursing without knowing when they had their last pain medication. These were their last vitals 4
yep.
hours ago. What are their vitals now? You've got to compare them. Were you able to do that wound dressing? Are they on a vent? What are their vent settings? Do they need to be suctioned every hour?
Is there standards? Like, is it a 5-minute brief? Is it a 15-minute brief? I'm
It
just
depends
curious.
upon the patient. We try to be specific. If you've got 5 patients on a med surg floor, you'd probably give a 5-minute report. But then you come this one patient who's having some behavioral issues or a change in
Right.
condition, and the family are getting involved. That may take longer. It depends upon the patient.
I've only swore to nurse one time. I was in New Hampshire, but you have a tough job, lady. I appreciate you doing that and
Yeah.
to bring up the concerns. This other people should hear this.
I'm trying to get nurses to listen to it. It's starting to get traction. I'm doing all of the editing. I had to teach myself how to do audio editing, video editing, how to do social media to put myself out there. I've had to beg nurses to come on the show because they don't want to talk about anything because I'll lose my job. Nurses are so abused that they don't want to talk about anything because even though they
Yeah.
need to. That's the only way you can make your profession better is if you talk about it.
Yes, ma'am.
So it's been a lot of work. But once I get this podcast going, and if I could hire somebody to do all that other stuff, and I just do the podcast, it'll be a really good, well-oiled machine, and there will be other nurses that will want to be a part of it.
Oh, I think it's a good little training lesson, a reminder.
A
Let me see your right hand.
reminder,
Your right hand. Just
like
holds a good coffee cup.
a glass of wine.
All the nurses drink a lot of coffee, I hope.
That's the goal for this podcast. No one else is doing it. I've got that market, and I'm writing a book to go with this. My process, how I started, and also all the, the controlled healthcare system.
I got 300 pages of my correctional career in a book.
Why don't
So
you write that book?
I work on it a little bit here and there because I got some good stories and I got some messed up stories. At the prison, I watched an inmate eat a radio to include the batteries. We had to bring him up to the hospital, and they had to open them up, take the batteries out of them, and when we got back, he opened it back up and stuffed it with feces, his own. And he used to cut every time he saw me. He knew I was on, because that's the worst thing I hate, seeing this gutter. And I tell a lot of those.
So corrections is very hard. Corrections,
Yeah.
I have a mad amount of respect for corrections officers.
I miss it, but I don't.
It's one of those fields. It's a little bit like nursing. There's like an adrenaline rush to it,
Oh,
and it feeds your ego in that way. It's very
I've been-
similar to nursing.
I've been part of 4 escape attempts, and the feeling you get after knowing the community, this murderer is not back out in the community, this rapist, and you get a good
Right.
feeling about that. Yeah, they are.
Yeah.
They are.
Protecting the community. They're always trying to figure out how to pull something over you.
In the 90s, we used to call them all MacGyvers. They could sit in their cell all day. So 95, I watched an inmate put 2 pieces of pencil lead in an LS socket, take a paper clip, put toilet paper around it, drop it on the 2 things of lead, and it would spark so we could light a cigarette. And I said, I would never think of that. It just...
All they have all day long is how to think of things that they can do with whatever they have. It's amazing. It's crazy.
Yep.
Like I've really enjoyed this show. We've kind of touched on a lot of topics, and I like that.
Oh, you should send this to HRs, the HR people. That's who should see that, not just the nurses. Maybe your
Right,
director.
because they're in charge of helping make the workplace more
Enjoyable, right?
every complaint should be looked at. Every single complaint.
And not swept under the rug.
Yeah.
Like I said, I could talk all night. If there's another podcast you want to do, we should set it
Yeah,
up.
we'll do another one. Thank you, Mike, for coming on the show.
Thank you for having me.
I'll have you back.